bed bath. So I'm just gonna remove my watch right away. Any rings that I have. Okay, get that out the way. All right, so I'm gonna go see my patient. Good morning, Mrs. Jones. How are you? Very good. My name is Jennifer. I'm going to be your student licensed practical nurse today, or student LPN. I just need to check your bracelet, your ID bracelet. Is that okay? All right, let me just see your arm. Yes, it's on this arm. Can you tell me your full name and date of birth? Perfect. All right. Okay. So I'm just about ready to give you your bed bath. Is that okay with you? Yes. Nice. All right, so I'm gonna grab all my materials and I'll be back with you in a moment. Okay, so I'm leaving. Right, and I'm gonna get all of my materials. So make sure your hands are hand hygiene before you grab everything. What do I need? Two PKs. Four face towels. Two towels. One brief. Gown. And the blanket, a bath blanket. And what else? And gloves. Forgot gloves last time. Okay? What I could do, what did I forget to do?
Erase the side rails?
No. No.
Clean the bedside
Clean the
table.
bedside. Okay? So, it's up to you what you want to do. If you know that you're going to go see Mrs. Jones for her bed bath and you're going to get things prepared, you can grab a pair of gloves before you go in, right? So hand hygiene, grab a pair of gloves, go in, introduce yourself, tell her what you're going to do, tell her you're going to come back and get your material and come back. And in the meantime, before you leave, you can go ahead, put on your glove, sanitize.
Is there, that's the available in
The patient's room?
the patient's
Yes, you can, okay, so in different centers, you may have this one, it won't be in the patient's room. That's for sure, because it's a hazard. Because it's a drinking hazard. So if you have a patient who has dementia, they may do something with this, right? What you do have is in the nursing station, and sometimes throughout the hallway, depends. You'll have we call it Virox wipes. So they're like Lysol wipes, right? So you can bring a few of those in with you instead, okay? And you can wipe them, okay? But this is all we have. So we're cleaning. Good question though. Good question, I know that. Cleaning, so that when we come back, we have a clean surface to work with. Garbage, hand hygiene, I'll be back, Mrs. Jones. All right, so I'm gathering all my supplies. Okay, and now I'm entering the room. Material away from you. Okay, now, Mrs. Jones, I'm back. All right. Okay, I'm right-handed, so I'm coming on the right side of my patient. It would be awkward for me to try to clean her on the left side because I'll be forced to use my left hand. It's not going to work for me. All right, so that's there. I also need my bowl and any other toiletries that she may be using. So deodorant, cream, makeup, anything like that. Okay. So I have my soap, I have this. Okay. All right, Mrs. Jones, I'm just gonna put some nice warm water in the basin for you, okay? Go ahead. All right, depends on what you want to do. Now, when it comes to touching here, it's the patient's stuff, but many people have been in here. So if you want to go the extra mile, you can open with this. That way you know that your hands are clean. Test the water, fill it up. Remember, as warm, on the warmer side, because water goes cold very quickly. Fill up the basin about halfway. All right. You can test your water with your wrist, and then use the other one to. So now you know your hands are clean. All right, come back. Okay, Mrs. Jones, I'm going to raise the height of your bed. PDSB, bending. Put it at your good working height. That should be good. I'm gonna lower the bed and sanitize. Okay. So now I'm gonna adjust myself here. Make sure everything makes sense. So always want your water closer to the bed, because you don't want to be taking your water and passing it over everything, getting your things wet and contaminated. So let me do some adjusting here. This I can just rest it on her, because I'm going to be using that first. Okay, now gloves. How many gloves do you bring?
5 pairs.
At least. Very good. So, not including the one that you came in with to disinfect your table, this first pair is for when now, remember, assuming that you're not in a COVID situation where you have to wear gloves at all times and change when necessary. This is in a typical normal situation where you're going to use your discretion when you need to wear gloves and when you don't. Okay? So this is my first pair is for when I'm doing my frontal peri. My second pair is for when I'm doing my buttocks. My third pair is for when I'm removing my dirty linens, my floor linen when I'm going out the room. Okay, and actually, yes, and then I have one pair for disinfecting my table. So I do that first actually. So disinfect your table, and then another one to go outside with your floor linen, and an extra pair. Okay, in case one drops on the floor or whatever. Okay, so that was how much?
5.
5, perfect. All right, so now I'm ready. Bring the table as well up to your appropriate working height. You're facing your patient, never backing. All right, and now you can put on your. So place your bath blanket. Very good.
Privacy.
So I'm putting this on first. I haven't removed her, but thank you for reminding me. All right, I'm putting this on first. I haven't removed any of her clothes. Yes, you can put privacy. Okay, privacy, and then
Hand wash.
Wash your hands. Or disinfect your hands.
very good, because the curtains are
Very
filthy. Filthy. All right, so she's completely covered. If your patient is able to hold on to the under blanket while you take off, it's so much easier. If they can't, well then, you just go ahead. Take your time and remove your blankets and top sheet until the bottom of your bed, the foot of your bed. Okay, Mrs. Jones, okay, nice and warm. At this point, before doing the face, it's up to you. You could go ahead and undo her tie and just have that already done if you wish. Okay, so now I'm gonna also place my PK for my soiled linens. All right, and then I'm gonna place, I need 2 of these. I brought too much, I grabbed too much. All right, and I need 1 of these right now. Okay. Towel. You'll see some videos or some text that will say put it under the patient's head. It doesn't matter. Whether you put it under, I like to keep it here. I like to keep it right here like this. Okay, so now I'm ready to go. All right, so Mrs. Jones, would you like soap on your face? No, okay. No problem. Most patients will say no because they're afraid of getting soap in their eyes. Okay, so speaking of eyes, that's the first thing that you'll do. So remember, can you close your eyes, Mrs. Jones? Very good. Start from the inner to outer. If you need to do it again, you're going to change your surface because you don't want to bring anything that was dirty back into the same eye again or the other eye. Change surface, light pressure, inner to outer. Change surface, the other one. Close your eyes. Very good. All right. And again, observations. Is there any eye secretions, nose secretions, mouth secretions? You know, if they're coughing up anything. And if there is, you use your discretion and you wear gloves. Okay. If there's none, well then you don't have to wear gloves, right? So now your forehead and cheeks. And I just do 1 swoop or 2 swoops. It really doesn't matter as long as you're being gentle enough but still cleaning the face efficiently. You can go back into the water as many times as you need to freshen up your water. Okay, Mrs. Jones, just gonna do your nose. Okay. Change position and do your mouth. Okay, are you hungry, Mrs. Jones? So I'm gonna get you all ready for breakfast. All right, and then the neck. If the person has any folds under the neck, just make sure to get those as well. And then behind the ears, okay? In the ear, just right there, and then behind the ears. So if your patient has a lot of wax, you never use Q-tips, all right? You just try to go as we open up your washcloth and just go as far as your finger will let you. Never use Q-tips. And then you do behind the ears as well. Remember, if your patient is on oxygen, checking behind the ears, especially if they're using a mask or even the nasal prongs, you want to make sure that you're observing for any skin breakdown. And then you go ahead and pat. Close your eyes, Ms. Jones. Okay. Okay, Ms. Jones, I'm going to remove your gown, okay? Bend your arms for me. Okay. Always being sure to keep the patient covered and warm as much as possible. Now, right now, I realize that I'm bending over her a little bit too much. So I'm gonna take the time right now and bring her closer to me. Mrs. Jones, I'm just gonna move you a little bit closer to me, okay? All right, just fold your arms. Fold your legs, all right. I'm gonna use forward-backward weight transfer. All right, 1, 2, 3. Okay. Okay, so now I'm gonna do her arms. Okay, only expose the part that you're doing. Water, soap, good grasp, and you can use long backward, forward strokes. How does that feel, Miss Jones? Nice. Okay, next is, what's next? Hands. Open up, and you get all the surfaces. The back of the hand, the palms, and in between the fingers. Okay, look at the fingernails, see if they're really dirty, they need maybe some extra cleaning. How are the fingernails, are they too long? All right, and then underneath the armpit. Okay. Okay, Mrs. Jones. All right, and then you do the same thing for your rinsing, right? Same thing for your rinsing. Arms. Hands. Underarms. And dry. Would you like me to do the other side, or you guys are good with that? Would you like me to do the other side? Yes, no, mine. It's up to you. It's okay? All right, so the same thing on the other side. So I'm drying the arms, the hands, and don't forget to dry the underarms. All right, you're gonna cover her up. You're gonna do the same thing on the other side. Remember, just a little tip, like I said, you can, if you feel like you're still too much over with a regular person, right? Not a mannequin, their arm is easy to put over like this, right? It would lay just like this, so you don't have to reach over, you can just do everything like this, okay? All right, so that's the other arm. Okay, so now I'm gonna go ahead and remove the old gown, making sure to keep her covered as you do so. Away from you, and place it. Okay, Mrs. Jones, I'm gonna do your chest now. So like I said yesterday, I usually remove the gown down, or the blanket down. Keeping the arms warm, I put this here. Go ahead, freshen up your washcloth, add more soap if you need to. Okay, and I'm gonna do her chest. So now I'm coming and I can remove it. Okay, Mr. John, I'm gonna do your chest and your breast, okay? All right, so back and forth is fine. On top of the breast. Okay, and then under. Lift the breast and go in one swipe, usually away this way. All right, and here as well, you're looking to make sure there's no redness, there's no irritation. There you go. You're gonna do the same thing for rinsing. Top of the breast. Under. Under. And dry. Okay, at this point, if your patient has deodorant, I can take it and I can apply it. If you wanted to split the body up in half and do some lotioning, you can do that if you wanted to, or if you want to wait to the end. So I could lotion up her arms, All right, you can put some on her chest if you wanted to. So next thing is her stomach. So towel covering the top, the blanket covering her bottom. Freshen up your washcloth. Put soap if you need to, and stomach. You can go back and forth as you wish. If the patient has any folds, stomach folds, lift up, go in one direction, looking for any redness, irritation, and so on. You're gonna rinse in the same manner. And dry. Under the folds, dry. Anything that you rinsed and washed, you dry. So under all the folds, you want to make sure you're drying well. Prevent any fungus or irritation. Okay, Mrs. Jones. So, I think I moved her too close to me. Okay. All right. I'm gonna remove the towel, cover her, give her some privacy, keep her warm, remove the towel. And so now I'm ready to do her peri-care, her frontal peri-care. Okay? So I'm going, or what I can do now actually, just so I can keep her modest and warm, I'm gonna put the gown now. The elderly, they usually complain that they're cold. That's the most thing they complain about when you're giving them bath, or that they don't want you to do it at all.
Yeah.
Hurry up, I want to go to breakfast. Why are you doing this to me? I'm clean, I'm probably cleaner than you. You hear everything. Okay, Mrs. Jones, I'm gonna be as fast as I can. All right, I know you want to get to breakfast. All right, but we have to wash. Okay?
To feel fresh.
Exactly, to feel fresh. Your daughter's coming. Oh, I don't care if she's coming. I hope she took a bath. You hear everything. You hear everything. Are you going to force her to take a bath? Okay, Mrs. Jones. All right, we're almost there. Okay, so raise her, cover, tuck the new gown away so it doesn't get wet or dirty. Place this here to cover up a little bit more warmth, and then the legs are covered. Okay, so, okay, right, okay.
Do we sanitize?
So you can even, it's not 100% necessary. Because all I'm doing is removing the...
Hi.
So what I think I'm gonna do, so bring 6 pairs of gloves. Bring 6 pairs of gloves, and you're gonna use one because I just wanna make sure there's no doubt about anything, so that you don't have to do too much explaining. Because like I said yesterday, if after removing this, your hands are not visibly soiled, you can continue. But there may be some train of thought is that you touch something that was dirty, you should remove your gloves, and so bring 6, okay? So 1 to remove the brief, the soiled brief. So tuck, tuck. Take this part, if there's any residue, you can just, of BM let's say, bring it down and just tuck it underneath. Okay? Remove my gloves, and I can put it on one corner over here. So all my dirty gloves will go there. And now I'm gonna put on another pair of gloves. Can someone just put 1 pair of gloves there for me at the end? So we're bringing 6, please, large, thank you, Arnold. Okay. And while you're putting on your gloves, for modesty, you can cover her like this. Okay? All right, so I'm ready. Okay, soap. And I am doing my,
Cubic.
yeah, so pubic 7. Majora,
Jora.
change Majora,
Jora. Change the side. Expose the minora.
open, Menorah,
Jen,
change.
you won't ask the patient to bend over.
You can ask the patient to open their legs.
Okay.
Yeah, you can ask them to open their legs, sure you can, sure you can. Okay, if they can't, well then you may need to do it for them. Tell them, Mrs. Jones, I'm just gonna open your legs just a bit. All right, and then Menorah. Change sides, a good flat surface, and then you're going down, okay? Don't try, like I said yesterday, to get underneath there. Once you turn the patient to their side, you'll have access to the back of the perineum, so do a better job, okay? Just do what you can, the best job you can here first, all right? And then rinse. Okay, 7. Majora. Open, Menorah, center. Okay. Squeeze out any excess water. Pat dry. Put this here, remove gloves. Okay. I'm gonna cover you, Ms. Jones, okay? I'm just gonna go change my water, all right? Rinse. You need to put some soap in there. Just a little bit of soap to rinse it out. So you just did the frontal perineum and then fill. Again, check in the water. What I forgot to do, what did I forget to do with her with the water?
Ask her if she's okay with the water.
Very good. Very good.
It's okay for her.
It's not a make or break, I don't think.
Yeah.
As long as you checked it. If you didn't ask the patient to check it, I'm not gonna dock marks for that. Okay, but if you remember, ask the patient to check the water.
Sometimes they don't feel the temperature. So
Exactly, it depends on the patient. If it's if a patient that's all there, yes, it's fine. But sometimes, all right. You didn't have to hand hygiene at that point because your hands were not dirty and you're coming to touch something that's dirty, so you don't really need to hand hygiene right there. Back up to your working height. Okay, lower. Now your hand hygiene, because I'm going back to her. Okay, Mrs. Jones. I am going to turn you towards the other side, so I should have gone there first. It's okay. Happens.
Yes.
Thank you. Jean, go ahead and do that. Okay, Mrs. Jones, I'm gonna turn you towards me, okay? So just bring your feet this way. Bring your arms on your chest. Thank you. Can you look at me? Very good. Very good. All right. So you can use, we're gonna use counterweight. So shoulder, hips on a count of 3. 1, 2, 3. Okay, bring him up. Okay, I'm gonna bring the pillow here. I'm going to raise here. I'm going to, can I have your arm? You can hold on to the rail if you like. Bend her top knee. It's going to help her to kind of lean over a bit more. Okay, and make her comfortable. Okay. All right. Go around. Here. Okay. Get her clean gown out of the way. Okay, on a pair of gloves. Okay, Mrs. Jones, I'm gonna do your back, okay? Yes, I know, I'm going as fast as I can. Okay, so I want to, oh, I forgot about this one too, right? I need another pair of gloves. All right, so I want to get rid of this. Okay, I'm gonna put this over here with my gloves, change, here, and okay, so I'm putting on a pair of gloves, right? You could put on the gloves now and start with the back and go down. Or you can do the back first and then come down. It really doesn't matter, right? Because you're still going from cleanest to dirtiest. I have my 2 new face towels. Okay, if your PK is not too soiled here, if you wanted to, you can just put that there if you want. Soap, and then like I said yesterday, all depends on how you want to do it. You can go it this way, you can do it this way, you can do it this way. All right, however you wish. Okay, and then you're going to rinse. Remember, come all the way down to the back of the bat because sometimes urine comes right up there and you're gonna dry. Okay. And now the buttocks. Soap. Okay, remember I said yesterday you can go in a circle, each cheek, or you can go like this. Okay, it's up to you. Then you do the other cheek. And then you're going to spread the cheeks. And then if you see here that you need to do a little bit more cleaning, well then you go from here and go right up. Change your, go right up. If it still needs a little bit more, you need to go in the water and do a little bit more freshening up, no problem, up until it's really nice and clean, right? Because you don't want infection to there. Then you rinse, same manner. no, not yet. Okay, so I took off my gloves. So if you took off your glove, it's fine. Just go from underneath. This is dirty. Just go from underneath. Flip it. Right? This is considered cleaner, right?
Yes.
And you just roll. If you kept your gloves on, it's the same thing. Just flip it, roll, then remove your gloves. Okay? And now the brief. Oh no, you can put it now. You're right. You can put the new one now. Yeah, sure. You can put the new PK now. Okay, make sure it's by the shoulders until just below the buttocks. So just estimate, and just
Sometimes,
estimate how much you need on both sides. Tuck, 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 and now yes.
sometimes they put towel because during the procedure they might.
It's possible, yeah, sure you could. If you feel to do that, you could. In reality, you can. Alright? And after a while, you get to know your patient. He always urinates when I, so
When you make a stimulus.
when you make a stimulus. Remember, you place here first, and then whatever's left, you push inside. Okay? And just tuck this part here. Okay, Mrs. Jones, come back for me, okay? It's okay, I have you. You might feel a little bump underneath you, okay? Come back. Very good. Fix her head. So to fix someone's head, remember, you're gonna scoop. Don't, right? So scoop under the neck, on the head. Lift, place. Fix a little bit because I want to turn her towards me now. Okay, just move your this way. There you go. All right. Shoulder, hip. 1, 2, 3. Okay, go ahead and want to come this way, Dawn, just so you can see how. All right, so I'm not touching the inside, I'm still on the outside. Just continue to roll it. The old one, go like this, take it, put it with your thing, and then the clean one, just roll it out. Okay, so again, I kind of put too much on that side. Okay, and then you have the new one, just make sure it's on there good, and that it's covering the buttocks well. And then Mrs. Jones, just go back on your back. All right, thank you. Okay, I'm just gonna fix your brief for you. Okay, so again, just like Peter reminded me, the upper thighs sometimes have some extra fold or they have extra skin. Just make sure you put it out of the way so it's not gathered up in there and being uncomfortable, and just place the seam nicely. Not too much so that they feel like they have a wedgie or it's irritating their groin, just enough to place it well. Same thing with the other side. And then you can go ahead and this is obviously too big for her, right? She doesn't wear an extra large, right? So of course you're going to place you're gonna pick the correct size brief. All right, okay, Mrs. Jones. All right, just put your legs straight for me. All right, how do you feel?
Freshen up.
Very good. Okay. All right, so next part. I'm not touching the inside. Out. Out. Oh, I forgot some stuff here. Okay, so what I should have done before I took off my gloves, remember, after I did her buttocks, I should have also since I have those dirty gloves on, gotten rid of these. Okay? So I should have gotten rid of those. So I'm gonna do it the right way because I forgot it. So if it was an exam and I didn't do it that way, well then I would have to put on gloves, right? So let's do it the right way. Squeeze out excess. If you could have done it with one hand, that's fine too. But I'll just go ahead and fix it. Okay. Anything else I need to? Okay. Remove. Okay, I'll hold it from the outside. Outside. Just, oh, I need to add this in there as well. Okay, away from you. Lift up. Ms. Jones, I'm just gonna move your leg over a little bit. Okay, all right. Make sure patient is comfortable. I'll fix that side after. Okay, here's your call by Mrs. Jones. I'm just gonna do some cleaning up and then I'm gonna come back and I'm gonna get you into your wheelchair using your lift, okay? All right, so this gives me a little while. Lower bed. There. Okay. Yes. Take my water away. Remember that. Empty. Remember, if there's any remnants of stool or anything, you put it in the. It doesn't matter. Okay. Put it in the toilet. Okay. Disinfect. Make sure you rinse it really well. Because of, like I said yesterday, the first place you're going to be washing is the face. So you don't want any residue, stool, and also residue of the disinfectant. Okay. Dry inside first, because inside is the cleanest, and then outside. All right. Okay, come back. Put this away in your patient's drawer. You can put away all their other stuff, anything that they were using. I have extra of these, so I'm gonna leave them patient's room for the next time. Bring this over here. Put on a glove. Paper towel, disinfect. Remember, some remnants of stool could have leaked there or dripped there. All right, and then I have my one last glove. Because I really don't need, I do need two. I do need two. So, Amelda, can you bring me one? Just one. You do need two. So, yeah, so bring 6 plus 1. 6 plus 1, just like one. A single one. Okay? And then Mrs. Jones. Oh, what did I forget to do? Forgot to lower this one. It's okay, I'm touching dirty. I'm going to be touching dirty, so that's fine. Dirty, dirty. Mrs. Jones, I'll see you soon, okay? I'll be back to get you up in their chair. Grab. Make sure everything is separated. I have all my things here. Make sure that your brief and your gloves are easily accessible. If they're not, just make sure that that's like that first. So it makes it easier for disposal. Okay, I'm outside the room. First thing, get rid of the brief. Gloves. Oh, one more glove hiding there. There you go. And then hamper. Try not to touch. Sometimes you just need to like just press it a little bit. And then, and hand wash. All right. So that's it.
At least Wednesday.